Hey, Denise.
Hello.
How are you?
As I always say, living the dream. Living the dream.
I'm going to stop sharing my screen so you can share your screen. And turn my phone down.
I did that yesterday. It was very loud.
It's not even on. I must have pressed a button. Okay. Century Tell. I feel like the prescription plan was always the most confusing part for me.
I think that for most people to grasp why there's so many different pieces of the puzzle when it comes to prescriptions, it should be a lot easier. I just don't even understand the mindset that created the prescription drug plan structure.
I don't understand.
So our job is not to understand how come or why they created it. Our job is to be able to navigate through it and have enough base education that we don't wind up putting ourselves in a position where we're getting penalized.
Okay, well, I'm super excited to talk about prescriptions and Part D. So back with Denise Anderson, so excited that we have her here with us to help us navigate through Part D and Medicare and the prescription plan. And I think that for those of you who have not joined before, I'm going to hand it over to Denise and she can introduce herself and then we will get started.
Great, thanks, Bethany. My name is Denise Anderson. I am a Medicare benefits advisor. So I've kind of given myself that nickname. What I do is I work with folks just like you who are trying to navigate the complexities of Medicare to make sure that you receive the health insurance benefits that you have worked so hard to earn. That you don't wind up in a situation where you're paying more for less, or even worse, facing penalties for not doing things in a timely fashion. I'm also an agency owner and a managing general agency. So what I do is I take care of protecting our beneficiaries and making sure that all my brokers are compliant and up to date and doing a fabulous job. So today we are actually going to talk about the almighty prescription drug plan. Part D. So if you're just joining us, Medicare has parts and insurance has plans. So there are typically 4 parts of Medicare. Part A is your hospitalization coverage. Part B is your medical coverage. Part D is your prescription drug coverage. Part D is a requirement if you do not have other credible coverage available to you. An example of credible coverage would be, say, veterans benefits. So if you have veterans benefits, the prescription drug portion of those benefits qualify as a waiver for Medicare Part D. If you do not have if you do not have a qualified waiver and you delay your enrollment in Part D, get this, you're going to be faced with penalties. So Medicare says that you must have a prescription drug plan when you are first eligible, so that, we just want to save you from any late enrollment penalties. The late enrollment penalties accrue based on the national average of premium dollars for prescription drug plans. So every year that number can fluctuate a little bit as to how much the penalty actually is. We're going to just make sure that you get enrolled on time properly and avoid anything that has to do with penalties. One of my main goals is to make sure people understand how to be a good consumer of their hard-earned benefit, and learning how the Medicare prescription drug plans work will help you actually be a very good consumer of your benefits. So we're going to get started. Medicare prescription drug plans come as one standardized plan that all prescription drug plans must follow, but they can make some adjustments. So as we go through today, I'm going to kind of mention what you might want to be looking for when you're shopping for your prescription drug coverage, so you can understand why some plans might look a little different than others. So first off, we have our deductible period. So a deductible, if you do not know, is the amount of money you're going to pay out of pocket for services prior to the insurance kicking in. So basically, you're going to pay cash out of pocket for some period of coverage. Once you've satisfied that deductible, you'll be in the initial coverage period. The initial coverage period is when the insurance carriers negotiated or published rates, if you will, published rates kick in. So whether that's a $0 copay or you have a 25% copay, whatever it is on that fee schedule for your Medicare Part D plan, that will kick in the initial coverage period. The initial coverage period may last your entire year for some of you, and some others may fall into the dreaded coverage gap, also referred to as the donut hole. If you're new to Medicare, it's a much better situation than it has been in the past. But once you have spent jointly out of your own pocket for your deductible and your initial coverage, once that total spend is $4,020, and sorry, I said out of your own pocket, this is combined. So out of your pocket for the deductible, combined coverage for the insurance carrier's portion and your portion, once that total spend is $4,020, and this is the 2020 rate, it will change for 2021. But once that number has accrued to $4,020, you fall into the coverage gap, donut hole. Now they called it the coverage, or they called it the donut hole because for quite some time, when drug plans were first launched through Medicare, there was zero coverage in this period of time, or this coverage period. Thankfully, our coverage gap right now is 25% of the retail cost of the drug, and that's for brand names and generics together. Just a couple years ago, it was 37%, and a year before that, it was near 50%. So paying 25% of the retail cost of your drugs is a far better conversation. Now, you've continued to pay that 25%. We still count what you paid out of your pocket in the initial coverage period, and we still count what you paid in the deductible period. You reach catastrophic, horrible sounding, but catastrophic after you personally have spent $6,350 on your covered prescriptions. Once you hit catastrophic, you're going to pay no more than 5% of the cost of the drugs. So for some of us who have really expensive drugs, we may get through the deductible, the initial coverage period, and the gap all within the first month or two of the year. Others of us who have more moderately priced drugs, we may fall into the coverage gap a little later on in the year. If you fell into the coverage gap last year, likely you're going to still reach it next year. And I'm always, come July, I'm always in the wrong year because we start our certification for 2021 in July. So when I talk about next year and last year is actually the current year. So forgive me, I'm always trying to remember what year I'm in. So for the 2020 calendar year, if you fell into the coverage gap or into catastrophic, you'll likely fall into it again for 2021. Couple things to note when we talk about covered drugs. If your drug is not covered by your insurance plan, it doesn't count toward any of these periods or coverage phases. So if your drug is not on the plan's formulary, which formulary means a list of covered drugs, and you pay full price for it, it doesn't help retire your deductible, and it doesn't count toward your catastrophic coverage. This is basically the same information. We're just putting it in a little bit different format because it is kind of hard to digest. So your deductible phase, the maximum deductible that can be charged in the year of 2020 is $435. So once we spent our first $435, we fall into the initial coverage period, and that is where we're paying our co-pays and our co-insurance based on the insurance that we have chosen. We fall into the coverage gap once the insurance carrier and your co-pays equal $4,020. And then once you have spent out of your own pocket $6,350, you will graduate to catastrophic coverage and pay no more than 5% of your prescription drug cost. So I mentioned that the federal government requires us to have minimal drug coverage. This requirement began with the modernization of Medicare back in 2006, when the Medicare Advantage plans kind of came into play. Prescription drug plans are considered an Advantage plan. So when you're looking at your coverage options, Medicare, original Medicare A and B, those are obtained directly through the federal government. Your Medicare Advantage plans, whether it is the all-inclusive HMO PPO style or a standalone prescription drug plan, which we're speaking about right now, those are all going to be administered by a private health insurance carrier. So you can't go to your Social Security office and enroll in a Medicare prescription drug plan. You're going to need to obtain that through a private health insurance company who has a contract with Medicare. All prescription drug plans have a specific list of covered drugs. So every year, Medicare has a defined list of drugs that every plan has to offer, but every plan does not offer every drug available to us. It's really important every year. If you do nothing else with your Medicare, you set it and forget it, please don't forget your drug coverage. Every year the formularies change. So that formulary, that specific list of drugs, they change. And they can change from adding drugs or removing drugs. They can also change from tiering drugs. So Medicare has tiers that all drugs are listed on to help us shop for our plans. Just make sure you double check, triple check. Drug can change tiers, and it can also be removed from the formulary. If your drug is removed from the formulary middle of the year, so you obviously can't make a change because it's not the annual enrollment period, your carrier must notify you, written notification that your drug will be removed. And if that occurs, you can always ask for an exception to their formulary. So that means that you are needing an exception, adding that drug back into your personal formulary. It's not the formulary that all the rest of us would have access to. You just are granted that special permission. But at the end of the year, when we go through our annual enrollment, you really need to make sure that you've paid attention, because they may not give you an extension or a exception for the following year. All plans are going to have some type of premium. So we want to make sure we understand how much we're obligating ourselves to. Just because the plan costs more monthly doesn't necessarily mean its formulary is richer. The benefits may or may not match your specific needs. So you want to make sure that you do your due diligence and ensure that the drug plan you have covers your drugs for your personal formulary from year to year. There's two ways to get a prescription drug plan. One is the standalone prescription drug option, and the other is to enroll in a Medicare Advantage plan that also includes prescription drugs. There's a few exceptions, but for the most part, if you choose a Medicare Advantage plan that does not contain a drug component, you will not be able to enroll in that drug component separately. So you need to do your due diligence and be aware of what you're actually enrolling in. So we are looking at the numbers here. Whoopsie, we've got some confusing on the numbers. My fault. We're gonna pass that because I don't want you guys to be confused. I will talk about the maximum deductible. Actually, I will go back here, sorry. Let's skip around there. The maximum deductible, this $435, it is the maximum that a plan can charge, but they can also charge you less. So if you're looking at the drug plans that are offered in your area, drug plans are specific to state. So all of the drug plans that you have available in your state will be the same, but you may not have the same plan designs that are available in your neighboring state. That $435 drug deductible sometimes can be reduced. So maybe it's not $435, maybe it's $425, or it can be waived completely. So it's zero. You will notice when you look at drug coverages that those $0 deductible plans, so you don't have that initial part that you pay up front, will be significantly more expensive over the total cost of the year because the premiums are going to be higher. It's always a good recommendation when you're shopping for that drug plan to do a calculation of whether paying that little bit of the deductible up front leaves you more money in your wallet later on throughout the year, especially if you're not utilizing the plan to its maximum benefit. I'm going to stop just for a second and ask if there's any questions or how confused I have you at this moment with prescription drugs.
There are a couple questions. Can a Medicare supplement plan cover Plan D?
Medicare supplement plans are not allowed to include prescription drug coverage at this moment in time. If you are an older beneficiary, perhaps you're helping your parents or grandparents with their plans, prior to prescription drug plans, standalone plans being available, there were some prescription drug benefits bundled into supplement plans. Those are not available. They have been removed off the market. However, some older Americans still may be in those plans. If they are available or they are still in those plans, that is not credible coverage. So if they came out of that plan and went into something that was modernized, they'd be looking at a late enrollment penalty. Not fun.
Huh. Okay. So would they have one carrier that has a Medicare supplement plan and they would need a separate prescription plan?
Correct. So if you are acquiring your coverage through a Medicare supplement plan, you will actually have 3 types of ID cards. You're going to have your red, white, and blue Medicare card that says you have your Part A and B benefits. You'll have your Medicare supplement card, and you will have a separate standalone prescription drug card. So I call it the deal of cards. But you will have 2 separate policies. You can purchase your drug plan most likely through the same carrier that you have your supplement plan through, or you may purchase them from completely different carriers. And a caveat to note that is that typically they don't give you any discounts. So there's not usually a discount if you keep all of your policies with the same carrier.
Okay. And did you say that Medicare Advantage plans include Plan D or prescription coverage, or they also don't?
Most of the Medicare Advantage plans do include your prescription drug coverage. Medicare Advantage plans, and we're going to do a real deep dive tomorrow. But Medicare Advantage plans typically cover your medical, your hospital, and your drug coverage in one policy. It's going to look and feel very similar to insurance that you've enjoyed throughout your life. It is not the 3-card deal a deck.
Okay. Is a calendar year of coverage January 1st through December 31st?
Yes.
Okay.
All Medicare plans run, all Medicare Advantage plans, drug plans, and Medicare all-inclusive drug plans, or all-inclusive plans, whether it's PPO or HMO or POS, those all are calendar year. Your Medicare supplement plan anniversary date will become your birth date. So once you enroll in a Medicare supplement plan, the anniversary then, no matter when you enrolled the first time, the anniversary will be your birth month or your birth date.
Okay. What is the difference between annual enrollment and special enrollment? Am I supposed to enroll in Medicare Supplement and Advantage at the same time, around the same time?
Well, so annual enrollment is the time frame for folks to make changes to their Medicare Advantage products. So that will either be your Medicare Advantage insurance, so we can call that Medicare insurance plans, or that will be your prescription drug plan. So that is the annual enrollment period. It occurs every year between October 15th and December 7th. That is your time to adjust and look at premiums and look at additional benefits if you're participating with either a Medicare Advantage plan or a prescription drug plan. If you have a Medicare supplement plan, the annual enrollment period has no effect on the Medicare supplement portion of your insurance. A special enrollment period, or SEP, those occur when we have some life changes. So we talked about the initial enrollment period previously. That is your very first time enrolling in Medicare. But let's say you delayed it because you worked past the age of 65, and now you're leaving your employer coverage and you need to begin your Medicare coverage. Beginning your Medicare coverage because you are leaving employer-sponsored coverage is a special enrollment period, or an SEP. Another example of an SEP, or special enrollment period, let's say that we are residents of Texas, and pick a county in Texas, and you're moving to Colorado. Well, the plan that you most likely have in Texas as an Advantage plan is not going to be available for you in Colorado. Maybe very similar, but it won't be exactly the same plan. And so that change of address or that change of locale would create a special enrollment for you. At that point in time, you could choose to stay with the same type of coverage, so get another Medicare Advantage plan, but perhaps you're moving to an area that the Medicare Advantage plan would not be your best option. Access to care might be a little limited, or you may have to drive extended periods to meet up with healthcare providers. You would have the option of enrolling in a Medicare supplement plan.
Okay. So did I hear you correctly that the annual enrollment, October 15th through December 7th, is for Medicare Advantage and your insurance, but supplement isn't?
Correct.
So supplement can be changed anytime?
No. Medicare supplement plans, depending on what state you live in, you may have what's called the birthday rule, or you may have to be subject to underwriting if you're switching plans. So in California and Oregon, there is something called the birthday rule. So the month of your birth month is a period of time in which you can change plans. We talked about the different plan designs. So Plan F, Plan G, Plan N. So if you are in Plan F and you happen to live in California or Oregon and you want to switch carriers, you still want your Plan F, but carrier B is now less expensive than carrier A based on age or whatever factors might come in there. You are allowed a one-time change per year during your birth month. Other states do not offer that. So each state has some states have specific rules as to whether or not you can change supplement plans without underwriting, but in most cases, you'll need to submit to some health questions for them to determine whether or not the new carrier that you want to go with will issue you a policy.
Whew. Okay.
Sorry.
That's a lot. Someone's asking for an example of a donut hole. Can you give an example of what a donut hole is, or like how this would happen in real life?
Sure. Let's go back here. Now, let's see. Which slide do I want to use? Bear with me, guys. All right, let's use this one. So I am taking an injectable, one of the biological injectable drugs that we see advertised on TV frequently because they're advertising the heck out of them. And let's say that drug, retail cost of that drug is $10,000. Pretty expensive. Month one, when I fill my prescription, I'm going to retire my deductible of $435. I'm going to fly through my initial coverage period because that stage was up to $4,020 of spend. So that's what I paid, what the insurance company paid. So I've spent my $4,020. I've already exceeded my out-of-pocket or the spend limit. My total out-of-pocket is going to exceed $6,350, right? Because my drug was $10,000. And I'm now in catastrophic for my second month. Example one. That's how you get through the donut. That's how you get from the start to the catastrophic in 1 month. Very expensive drug.
Wow.
Now let's talk about somebody who has maybe a fairly decent drug list. They're spending a couple $100 in copays per month. So first off, in the deductible phase, they're going to retire that $435 deductible or whatever the deductible is for that plan. Then they're going to start making their copays based on their prescriptions. So every time they go to the pharmacy, they're going to pay their copays. And let's say they're paying a couple $100 a month in copays. Every time they have a prescription filled, the total cost of that drug is calculated, and the drug carriers with Medicare are keeping track of the spend. They keep track of how much we have consumed or used. Once we reach that $4,020 spend, we are now into the coverage gap. So when I go to the pharmacy again, instead of paying my $200 in copays, I'm going to be paying 25% of the retail cost of the drug, or whatever the carrier with that pharmacy they give you a public rate for that drug. That 25%, strangely enough, could be more than the $200 copays that you're used to, or it could be less. So if you had a drug plan and let's say one of your drugs was on tier 3 or 4, and that drug plan had a cost share of 35% up through the coverage gap. Now that you're in the coverage gap, you're paying 25%. So you might wind up saving money, or vice versa. You may have been paying a copay of say $47 for that tier 3 or 4 drug, and now you're paying 25%. It could have been a $300 drug and you're paying 25%, or a $400 drug. That 25% may be more than what you were paying. Once you have spent out of your own pocket $6,350, now you're not going to pay any more than 5% for that drug. Okay,
so there's a 5% payment required even after paying the $6,350. So that means that you'll never get to a point where you've hit the maximum?
There is no maximum on the drug plan. So there's not a point in time with the drug coverage the way that it is set up today with Medicare that you spend out of paying for drugs. There are some programs available that would help people relieve some of the drug cost if they income qualify, but specifically to spending through a certain limit and then paying no more for your drugs for the rest of the year, that doesn't exist. So once you've spent into that $6,350 range, you're still going to accrue a co-insurance of 5%.
Okay. So how does someone budget for their maximum out-of-pocket costs?
What I do, and what I would encourage most people to find somebody to help you do, is we do an estimate. Now, none of us have a crystal ball, so we can't rub our crystal ball and see what the future holds, because if it did, a lot of us would have checked out of 2020, we would have opted out. But what I have my folks do is we look at the drugs that you require on a regular basis. So we make that list, then we go shop to see which carriers' formularies match up to your particular drug needs the best. You'll find some carriers don't cover all of your drugs, and you'll find some carriers do. The carriers that cover all of your medication, then you want to make sure that you're paying the least amount for those drugs. So my levothyroxine might be on a tier 1 and have a 0 copay with one carrier, and it might be on a tier 3 with another carrier and have a $47 copay. Well, if you like to budget like I like to budget, I'd prefer the $0 copay. So then we want to match you up, and then we can do a forecast. We can say, okay, this is the total cost of your drugs. This is your total cost of copay. It looks like you might hit the coverage gap in about October. Once you hit the coverage gap in October, this is the approximate for your medications for the rest of the year. And we bundle that in with the cost of the plan itself and try to come up with that budget. There's some unknowns in there, right? Your doctor could change your medication. You could require additional medication, so that number might fluctuate a little bit, but that's the way that we work with our clients to make sure that we at least have a target on the wall. It may vary a little bit, but at least having a specific number set so that you can figure out annually my drug budget looks like it's going to be X, and then you can figure that out on a monthly basis to make sure you've got your bases covered.
So if I'm on a bunch of medications and I still have access to my employer-based plan, then that might be the best bet.
Always good to compare. It possibly could be a better option for you. Just depends on how much your employer plan is costing and what your employer plan covers. And if your employer plan has more than 20 employees. If your employer plan does not have at least 20 employees on it, you won't have that option. Medicare will require you to come on into the Medicare arena.
Okay. So is this why you think people are trying to buy their medications overseas?
Well, we've had some really good movement in regards to drug prices, but absolutely our drug prices here in the US are not subsidized by the government, whereas they are in other countries. But there was a couple things that have happened through the current administration that have affected drug prices. So targeting generic drugs, bringing down the cost of generic drugs. We're going to see some really nice movement in the cost of insulin for 2021. I don't have all the specifics yet because that's what we're still certifying on for 2021. But I do know from some of the training that I've done this far, we will see tremendous relief for people who are on some chronic care medications. But yeah, there's a lot of people who go, well, I don't want to get to the coverage gap. I order your drugs, they order their drugs elsewhere, or they simply don't use their Medicare benefits, so that drug doesn't accrue. But really, you should sit down and do the math, because at 5%, if you're on very, very, very expensive drugs, that usually comes out to be less expensive than what you can source them from other countries.
Okay. Is there a place that I can get a list of new formularies or prices?
Yes, and I'll throw the caveat out there to be careful. So if you want to use Medicare.gov, they have made some significant improvements in that tool. You'll go on, you'll enter your zip code, you'll enter your drug names, dosage, and then their system will help sort by the plans that are available in your area. If you have already used Medicare and you have had a year or so or 6 months worth of data, you can use it's called the blue button, and it'll pull into your portal all of the drugs that you've had filled over the course of the year. And then you can select which ones are ongoing and which ones maybe were just a one-time thing. And then you can do a preliminary search for the carriers that would best meet your needs. It'll tell you if all of your drugs are covered, or if 3 of 4, 5 of 6, 2 of 10, whatever the case may be. Here's the caveat to that. It's not 100% accurate. So I last year was proud to find many errors and let them know, like, you guys, this is not right. So it's a good place to start to narrow down your search. But then I would also go to the carriers, that maybe your top 3 carriers, and make sure that you check their formularies. All of that information has to be made available to you prior to enrollment, so you can just check their formulary. Many of them have an online search tool, so you can just type in your drugs and it'll tell you what tier and what pricing they are and what their preferred pharmacies are. And that's really, we have another tool that we use internally, but we double check. So we will do kind of the same type of process with our clients. Again, it's a different tool. It's linked to the formularies in a big database, and unfortunately, there's not a consumer version of it. But Medicare.gov is supposed to be the consumer version, and it's supposed to be accurate. So hopefully they'll get it polished up next year. But we go through that same process and look at all of the carrier options and work with the budget we have to work with, whether it's going to be a Medicare Advantage plan or a prescription drug plan. Just always, before you make that final commitment that this is the plan for the year, double check their online formulary, whatever they have published, just to make sure that if you pulled in information from Medicare.gov, that it was accurate.
Okay. Is it considered illegal to buy medications overseas?
Not that I'm aware of. I have lots of clients who have one particular drug or another particular drug, and they do receive them from overseas pharmacy. I know if you're dealing with our neighbors to the north, you do have to have a prescription, and it has to be very much the same process that you go through here to a pharmacy. But I think at this point in time, it's still not, I think it's still okay.
Okay. Does Medicare help you qualify for lower cost drugs or through the pharmaceutical companies?
Again, another improvement that is in process. So a couple years back, we were not eligible as a Medicare beneficiary to receive the consumer discount for certain drugs. It had something to do with the way that the pharmaceutical companies and the federal government were dealing with tax things. And I'm not a good tax person. So there are some drugs now that the Medicare beneficiary is able to utilize what we call the coupon. So that is a positive change, and we're seeing more and more of those drugs available for the relief. If you have income needs and you need assistance with drug coverage, you can apply through Medicare for financial relief on your drug coverage. And depending on what your income stance is, you may qualify for different percentages of discounts, or even possibly qualify for Medicaid to help pay for those prescription drugs. So there's about 4 levels of coverage that you can possibly get some relief from through the federal government and or your state. Your state may have a state pharmaceutical plan as well that would work with Medicare to help reduce the cost. So if costs are a concern, one of 2 things: reach out to a broker and they can help you figure out what you may be eligible for, or give a call to the Social Security Administration or on Medicare.gov and apply for some additional relief.
Awesome. Thank you. Do you save money if your medications are mailed through mail order versus buying it at CVS or Walgreens or the pharmacy?
Depends on the carrier. There are some carriers that do offer a pretty nice discount if you are using their mail order pharmacies. Because remember, now their mail order pharmacies, they're kind of a conglomerate and they've got 1 location or maybe 2 distribution centers to manage versus all the brick and mortar pharmacies. So some carriers do offer a really nice mail order discount, and then some of them are not as aggressive. Just depends on their relationships. And again, that's a good point when you are being a good consumer to do your shopping and figure out which drugs you can or will mail order, and if that's going to save you some money.
Okay. Is an exception the same thing as an appeal?
No. So an exception is asking for just that, an exception. Most carriers, when we help people process formulary exceptions, we probably are about a 95% success because we support it with medical necessity. So I don't actually write the exception, or I just kind of handhold through the process, help you communicate with your doctor's office what needs to be done. Your doctor's the one that's going to document the medical necessity for that prescription. Now, if there's other prescriptions in the same class category, I call them like cousin prescriptions, that are covered, your doctor may need to indicate why you can't use that other prescription, like there's some other conflict, or that you've used it and you didn't have a favorable response. Those 2 situations usually come out with an exception approval. An appeal is when the exception or request for coverage of any nature has not been granted. Then you file an appeal.
Okay. So if I want a specific medicine or brand name to replace a generic drug that I'm having side effects with, does the doctor have to get an exception like with regular insurance to get that generic at a generic price, or get it at a generic price?
So you may have one of 2 things happen. If the plan covers the brand name drug and the generic drug, so they have both of the drugs on the formulary, then the brand name is going to be at a higher cost. That's one option. 2 option, they don't cover the brand name. You are having, you're not successful on the generic, and you're asking for that brand name drug to be added to your personal formulary. Most of the time, they're going to put it at a brand name tier. Not going to see it at a generic tier most of the time. And then you can also file or request to have the tier pricing lowered. So if they approve your brand name drug and it winds up going on to tier 4 per se, then you can request a tier exception and see if they'll lower it to tier 2 or 3. So there's kind of a couple different pieces of that puzzle, depending on what the carrier's coverage is for that drug and what your medical necessity is for that drug.
Okay. do the doctors have a way to check and see what medications are covered by my plan so I don't end up with something that costs way more or isn't covered, or there might be a cheaper option available?
We all have a way to check. Most doctors that I deal with say, call Denise, she'll check it for you. And they'll give my clients a list of drugs that I need to check. Because why would they want to look up the drugs for you? What I would suggest doing, there is a formulary. The doctors can find it. You can find it. Once you're with your plan, most of them have fairly decent member portals where you can go in and just pull up your plan and type in the drug name that doctor gave you, that because he doesn't want to type it in, and find out what coverage level that is. You can also use Medicare.gov if you'd like for a preliminary search if you're thinking about making a plan change.
Okay. Does Medicare provide an insurance advocate?
I would need to know a little bit more about what an insurance advocate. If you call Medicare directly and ask for help selecting a plan, they're going to use Medicare.gov the very same way you would, and the information that pops up in front of them is the information they're going to give you. They may not be intimately familiar with the insurance carriers specifically to your area, and in addition, the healthcare provider systems in your area. So for example, a broker who covers your area may know a little bit more about the centers of excellence that you may want to access for certain treatments or health issues than the person at Medicare. You can get assistance with certain things through an ombudsman, that's usually run through your state. But as far as an advocate specifically for Medicare insurance, I'm going to tell you, you have to really learn how to be a good advocate on your own. I think you guys are going to get some help with that later on in the week. And your broker can be your advocate. So when we enroll someone within our organization, they have lifetime customer support. Any help that our clients need with trying to figure out why something was denied, why is my referral not coming through, how does this work? I'm confused, I'm lost, I'm stranded. We've probably been through it before, so we help advocate for the client base. But a specific advocate within the Social Security Administration to help you with Medicare, if there is one, I'm not aware.
Okay. And I think, so I don't know how many slides you have left, Denise. We still have questions, but I don't know if there's more you want to cover. And then we'll see what we have left for questions.
Yep. So the last slide we want to cover, I think it's the last slide. Let me just make sure. Sorry. Well, we got a couple extra slides here. So let me go back and get on track. Part D premium. We talked a little bit about the fact that every Part D plan is going to have a premium. There's also something called an income-related adjustment to your premium if you are of higher income. So if your income is 174 or less and you're filing a joint tax return, so you and your partner on the same tax return, or you're married filing separate or individually, you have an $87,000 limit. Your plan premium will be whatever the plan premium advertised amount is. So $22 a month. If you're of higher income, you are going to have an income-related monthly adjustment. We call her Irma, and I'll apologize if anybody is named Irma, but we don't like Irma in this case very much. So you'll wind up receiving an additional amount added to your premium. So if you're in that 174 to 218 category as filing jointly, you're going to have an additional $12.20 added to your plan premium, all the way up to $76.40 if you're in the highest income bracket. So again, when we're talking about budgeting, somebody said, well, how do you budget? And you need to budget, right? We need to also consider the income related adjustments in our budget if they pertain to us. So some other key terms that we kind of talked about, prior authorization, not really, but we talked about exceptions. So some other terms that you might want to pay attention to when you're searching your formulary, these little asterisks. So PA, or prior authorization. That means that the drug is available, but only after your doctor shows medical necessity will the plan approve it. So that typically comes up when we have a higher cost drug and a lower cost drug, and they're both on the formulary. Prior authorization can also come into some controlled substances. QL stands for quantity limits. Quantity limits are dictated by what the Drug Administration says is the maximum amount you can have or be prescribed of that particular drug. So if your drug has a quantity limit, you need to pay attention. Sometimes docs are really creative and they will give you a prescription for 2 times the amount, which is 2 times the FDA amount. What they want you to do is divide it up or take half or something of that nature, which is fine. They probably know what they're doing. Medicare will not approve your drug to be filled at a higher count, whatever you want to call it, than what the FDA says is allowable for that drug. Step therapy is available for you to try to move to a different drug on the formulary. So if your drug is on the formulary, but they want you to try these other drugs that are also in the same classification, your drug may not be available to you if it's under step therapy until you've gone through those steps. I hope that kind of makes sense. When you're looking at a drug formulary, you'll see these little indications here and there. Just make sure that you're aware that you know when you do see those little asterisks that might dictate how and how much of your medication that you have access to. The vocabulary words that I was kind of referring to earlier that you want to pay attention to. Formulary is obviously the list of drugs that is covered by the plan. So you have your own personal formulary, that's the drugs that you need, and then the plan's going to have its formulary, the drugs that it provides. You want to make sure those two match up. Drug tiers, so standard plans with Medicare will have 4 to 6 tiers. Most of them have 5, and there are some that have 6. The tiering is so that you can figure out how much the drug cost is according to the plan's formulary. Typically, we have tier 1 and 2, which will be generic drugs. Tier 3 and 4 will be brand name drugs. Tier 5 will be specialty drugs. And I'm super excited. I saw a couple carriers breaking out tier 5 into 2 categories, preferred and non-preferred specialty drugs. Sorry if you can hear the lawnmower going by. Technology and great stuff. And then we also have tier 6 with some carriers. Tier 6 is a specialty tier where they carve out some drugs, so like diabetic drugs or heart medication, and put those in a protected tier so that the cost of those drugs are a little bit lower. Network. Somebody asked about the mail order drugs. The other thing you want to pay attention to is your pharmacy network. Some of the plans will have reduced cost if you're using an in-network pharmacy versus an out-of-network pharmacy. So when we're searching for our drug plan, not only should we make sure that the formulary is covered, but if you have a good relationship with your pharmacy and you're always there and that's the one you use, make sure that the plan you pick also includes your pharmacy. And then transition process. So you enrolled in a plan that didn't cover all of your drugs, and you're going to need to make a transition from drug A to drug B. The drug plan that you enrolled in that does not cover your drug today must give you a one-time refill to transition you from that drug A to drug B. How confusing is that? Try to make sure that you get your drugs covered. So that is the last slide, Bethany. We'll go back there. Any more questions on using drug plans?
So with Medicare part of what is taken out through Social Security on supplemental Medicare.
So I'm sorry, do that again.
Is Medicare Part D part of what is taken out of the Social Security monthly payment?
No.
Okay.
What is deducted from Social Security will be your Part B premium only, or your Part B premium with your income-related adjustment.
Okay, so Part D is always private health insurance. It is not part of Medicare Part A or Part B at all.
Sorry, the lawnmower decided to stop right out in front of my door. Try that again.
Part B, Part A and Part B is what is base Medicare. Part B is always private. And
so yes, your Part A and Part B are the federal portions of Medicare. So that's administered through the Social Security Department. That is original Medicare. And that is the portion, well, most people have premium-free Part A. If you've worked 40 quarters and contributed your FICA taxes, your Part A will be no cost to you. You've already prepaid for it. Part B will have some premium based on your income. And that is the original Medicare. Part D or Part C you acquire through private insurance carriers, and that will be a separate premium that you pay directly to the carrier, or you can opt to have it taken out of your Social Security benefit, but it's not the base amount.
Okay.
So let me go back and clarify that, because that's pretty confusing. So A and B managed through Social Security, that comes out no matter what. If you sign in for a Part D and or Part C plan, you can ask them to draw it from your Social Security benefit, but it's not part of the part Social Security takes automatically.
Okay. So everything from C and beyond is private, have to get that from somebody else besides federal Medicare services that are provided.
Correct.
Okay. Do you know if any Medicare drug plans are covering CBD oils?
CBD is not an FDA drug, so that will be no.
Okay. Can it be possible that I take no prescriptions and never use Part D, so I let it go and no longer have to pay for it?
You can, and people do, but later on down the road, when you might need prescription drug coverage, if you come back in to a prescription drug plan, you'll be assessed the late enrollment or lapse of enrollment penalty. So you can do the math and figure it out. My grandfather, do a little sidebar, my grandfather, curmudgeon of all curmudgeons, spent a lot of time telling me how much he didn't need a prescription drug plan. And I spent a lot of time telling him how much he needed at least a base plan, because the base plan for where he was living at the time was less expensive than what the monthly penalty would have been. So it wasn't phenomenal coverage, but at least he had some coverage. And then he canceled the plan anyway, and I'd have to re-enroll him every year. And finally, he got up to about $70 of penalty premium for the $13 plan I had him in. So I would always, if your drug usage is very low, consider just maintaining the lower level coverage so that you're not going to put yourself into a position later on of having to pay, $74 for a $13 plan.
So can she get a base plan so she doesn't have that lapse? But
yes, absolutely. So depending on your area, there will be plans that are far less expensive. And they're going to have a higher cost share. So if you actually use it, you may pay a little bit more. But if you don't have a significant drug need and you just want to make sure that you're staying compliant, you're not looking at penalties later on, and then maybe you have access to some discounted rates for things like, generic antibiotics or whatever you might need, that's, in my opinion, a far smarter way to go than waiting until you need it and looking at that penalty, because that penalty seems to tend to go up every year.
Okay. Denise, you mentioned someone that we might be able to get help from. Is there anything like a walk-in center if I have problems with my coverage or medication? Like some of the health insurance places have these little kind of strip mall stores that you can go to and say, I'm stuck with this and this and this and this. Does that exist?
Most states have the what they call it, the state health insurance or SHIP providers, or they're supposed to be, they're supposed to be, what is the word I'm looking for? It won't come in. Darn it, I hate getting old. They're supposed to be neutral, and they can help you navigate if you don't have an insurance broker or advocate. If you have issues, they're supposed to facilitate and help you go through coverage issues. As far as where you can walk into those, regionally, I would have to do some digging to be able to tell you exactly where you might find them and what parts of the country.
Okay. So, but you said it might be a state level organization?
Yeah, it's called, the acronym is SHIP.
Okay.
So the federal level that manages or looks over health insurance and specifically Medicare is the America's Health Insurance Plan. And on the state level, it would be the state health insurance plan group. Okay. If you Google SHIP, you can find it.
So in Florida, it's called State Health Insurance Assistance Programs? No. Is that it? SHIPTA. Yeah, local Medicare help. They have regional offices.
Every state does things a little different, and my state likes to do things way different. So,
okay, so it looks like it's state health insurance, and we added an A to ours because we want to be special assistance programs.
Fair
but
enough.
The logo says SHIP. It's confusing. Is there a refill sync program where I can get everything all at one time?
Many of the carriers, especially moving into 2021, I told you there was some fun things happening, and I'm super excited about improvements. I get all excited. A lot of the carriers that we're seeing boasting about their new and improved product offering are doing the bundling of the prescription. So let's say you take 5 different medications and you take 2 in the morning and 3 in the afternoon. They're putting them all together in the little quick use packages. So I kind of equate it to my vitamins. They give me the little plastic bag with my vitamins, and I'm supposed to take everything that's in the plastic bag twice a day. They're doing that. So they are moving into that convenience direction. A lot of the carriers are. So you just want to check on the benefits to see if that's an option. I know for a lot of my clients, having all of your medications renew on the same day is just so much easier than having, oh, this one I can't get until next Thursday, and this one's, 2 days from Friday, and gets confusing. But a lot of the carriers are going to that more convenience packaging.
Okay, that's awesome.
Yeah.
This is incredible. Thank you so much. Do you have any tips on how to simplify this process?
We do have our little cheat sheets that will be going out that will help you hopefully collect all of your information into one spot. Most important thing I can tell people when they're preparing for Medicare and or continuing with Medicare is to make sure that you're keeping all of your requirements, all your documentation together. And a little caveat, that will help you tremendously later on if family needs to come in and assist you with anything. Having all of your doctors' names, phone numbers, and what they're treating you for listed, having your medications, what you take them for, how often you take them, and what pharmacy you're using listed. Combining all that information and using that when you're shopping can be a lifesaver for you and your family members who may have to help you later on. Simplifying the drug search process. I wish I had the magic cure for it and I was 100% spot on and I could give you this cool little link and you could put in all your information and it would do it for you. We're close. Technology is really helping us along. But I would say that today, do your due diligence. If you have a broker or somebody that can help you, make sure they're shopping all of the plans that are available for you in your area. Use your Medicare.gov option. It's much improved experience, not perfect, but at least it will help you get down to the 2 or 3 carriers that you need to be looking at. And then from there, go ahead and go to the carrier website and just double check. The worst thing for any of us is to show up at the pharmacy January 5th and realize that we made a mistake or we didn't take action because we thought it was going to be the same from last year. And now we have drugs that aren't covered or costs that we weren't expecting.
Okay.
When I get my little magic tool all refined, I'll let y'all know.
That would be awesome. Somebody asked if you mentioned that you might be able to pay your deductible up front and to do the math to see if that makes sense. Can you explain what that means?
Sure. So take the cost of the premium. So let's just say that the premium dollar that you pay monthly was $20 and you had the $435 deductible. So take that $435 deductible, divide that out over the 12 months and attach it back to your premium. So I don't have a calculator here. My math brain isn't that fast.
You have to tell me what to type.
Okay, so take your $435.
Okay.
Divide that by 12 months.
Okay.
And then add that to the premium. So we'll say the premium is $20.
Okay, so that's $36 a month. So you want me to add 20?
So that the $36 is the $435?
Yeah.
So what I want when I tell you to do, or when I'm mentioning that, I'm taking the $435 that you have to pay no matter what if you have drugs filled. So that's your $36.25.
Yep.
Add that back to the premium that you have to pay to have the plan, which we're saying is $20 for this exercise.
Okay.
So that means your total plan premium really is $56.25, right?
Okay. Yep.
Now, if you look at the other plans that are available to you in your area with a $0 premium, are they higher than $56.25 a month?
Okay.
Because now if I'm looking at, I know my drug plan costs off the top of my head, the least expensive drug plan in my market with a $0 premium is over $80.
Wow.
So I pay that $435, as painful as it might feel, I'm still saving money overall. Does that make sense?
Okay. So you're not paying the deductible upfront. You're just trying to figure out the math.
Correct. Including the deductible into your number. You're gonna pay the deductible up front because you won't get coverage. You won't get your discounted or your co-pays to start kicking in until you've paid your deductible. So you're actually going to pay that in the first month or 2 or 3 of the year, depending on how many drugs you fill. But from an overall perspective, is how much that plan costs you.
Mm-hmm.
I put the deductible back into the plan premium so I can try to make those apples to apples versus apples to grapes.
Okay. Another question, do the pharmacy discount cards work with these type of plans, with Plan Ds?
Most, no. So the pharmacy discount cards, the ones that you get that are just, if you use this, you get 10% or 50%, or some of the chain stores, some of the grocery stores, I think Kroger has a couple discount cards. Most of them do not coordinate benefits with Medicare. If you're using a drug that's less expensive by using one of those discount cards, well, by all means, when you go to the pharmacy, tell them, okay, ring those up under my Medicare plan. And this one we do separate.
Okay. Someone at Bonnie said, can you please get certified in Florida?
One of my brokers is certified in Florida. So if you guys need help, I'll help you out.
Specifically so we can use you, question mark. I don't think Denise is around. Denise thinks there are other people like her, and I don't think there are.
I know there are. There has to be. There's a gazillion of us out there. You just have to dig a little bit. You'll find us.
Okay. I think those are all the questions. I know we ran a few minutes over, but I think this was fantastic information, and I'm so happy that Denise was here to answer these questions. Somebody said it sounds like finding the right broker is key to all of this.
You bet. And if your broker isn't appointed with the majority of the plans that are in your area, either encourage them to take on the extra work or find a new broker.
Okay.
Because you really need that shopping. You really need that comparison. One size doesn't fit all.
Okay. Denise, what about the places that you call and they're like the 800 numbers and they say, we have 30 carriers, call and get a quote. Is that a good alternative if you don't have access to a broker?
Boy, that's a loaded question. You may get somebody who's phenomenal on the other end of the phone and you may have a really good experience. Many of the folks that I have interactions with weren't so lucky. Most of the time, those folks in those call centers really don't know your local community and your local neighborhood and the providers in your area as well as they should. If you're pretty good about knowing your healthcare delivery system within your neighborhood or within your community, and you just need help refining the plans, it might work out well. But most of the time there's just that little bit of disconnect where a local broker, somebody who's in your backyard, they know your doctors, they know your hospitals, they know the little pharmacy that everybody uses that's privately owned down on the corner. So again, a loaded question. I can't say yes or no definitively. I can tell you that a local broker usually is a better fit for most people.
Okay. Do they call themselves Medicare brokers, or what would they Google search if they're searching for one in their area? Are they health insurance agents? What do they call themselves?
It depends on how they list it in the Google search. You could search with Medicare broker, Medicare agent. If you do find a health insurance agency, just ask them if they do Medicare. Some do, some don't. Medicare is really laborious in getting certified and continuing your certification. So, sometimes there's a little barrier to entry there. So some people are not interested in certifying every year. but yeah, just ask. But I think either one of those searches, Medicare broker, Medicare agent, should bring you up something locally.
Okay. Okay. If they're not certified, can I still find good brokers that may not be certified, or do I want to really look for someone that's certified?
You need to have somebody who is AHIP certified for sure, because that certification makes sure that they at least went through the federal government's training and are up to speed on any changes that might be coming for the next year. And then the carriers are going to make sure that, depending on what plans they offer, but the carriers are going to require them to be also appointed and accredited to represent their products. So you want somebody certified.
Okay, so is there a federal certification and then a separate certification at a state level or with a carrier?
The carriers are going to have, each person who is representing Medicare on a federal basis is federally certified AHIP, America's Health Insurance. And that's a requirement every year. And then the carriers, depending on the products they offer, so Medicare supplement plans, there's no certification for most. Some of them have a little something that they do, but most of them, agents don't need any certification to do those. But anything that falls under the Medicare Advantage umbrella, so that's your PPOs, your HMOs, your POSs, and your prescription drug plans, all of those require certification from the carrier and also from the federal government.
Okay. And then there are organizations serving health insurance needs. How about, hold on, let me read it. How about SHINE, which is serving health insurance needs of the elderly through the area of aging?
Not familiar with that one. May be something regional.
Okay, I think it is. I think it's a Florida organization. I don't know. I don't know how to answer that.
I can look it up and let you know.
No, I think that's the one. That's our version of SHIP, I think.
Okay.
But I don't know, because we have a lot of aging people in Florida. There are a lot of organizations that I think focus on the elderly or the aging.
Yeah, I'm sure. Yep.
Okay. Awesome. I think that's it. Thank you so much, Denise. I know this was probably the least fun day.
Tomorrow's the all-inclusive day. So tomorrow we'll pull it all together. Yes.
And we're going to send an email with all the checklists and stuff like that, so people have it ahead of time, but you don't need it to join tomorrow, because Denise has a lot of slides and pictures and pretty things to show to help our brain process all of this information without exploding. So thank you so much. I appreciate you guys for joining. Thank you, Denise.
Thanks. Bye.
Bye.